I'm Dr. Peter Derman. I'm a minimally invasive and endoscopic spine surgeon at Texas Back Institute. Endoscopic spine surgery is a minimally invasive, or what's now being called ultra minimally invasive technique for addressing traditional spine problems. Oftentimes taking pressure off nerves. Pressure on nerves causes pain radiating down the arms or down the legs. And the traditional way that this is done is to make an incision down the back of the spine, usually in the middle. And then once you're down there, cleaning up basically whatever needs to be done. The beauty of endoscopic spine surgery is it allows you to take pressure off the nerves without doing all that other damage to the spine. And so what it is akin to is if you have a shoulder problem, if you have a knee problem, you have a rotator cuff or a meniscus tear. The old way that they used to do this was to open up the joint and look at it and sew things up and trim things up. Now, they put a scope down, they put a camera down and look at things on a screen, and they can clean things up, they can, fix things, and you wake up right afterwards and you go home at it. And that's really what you're doing in the spine. You can scope a spine now. And that's fundamentally what endoscopic spine surgery is. So the way that it works is through an 8mm incision, so less than the width of your finger, less than a centimeter, a camera is inserted all the way down to the spine. Once you're down, then you can do the same thing that you would have otherwise done, which is clean up around the nerves, disc herniations, bone spurs, to alleviate that pressure and take away the sciatica. When I'm all done, I see that the nerve is all nice and happy. There's no pressure on it anymore. I remove that camera. Patient gets a little stitch under the skin, a tiny little Band-Aid, and is off to the races. So the endoscopic approach really allows you to address similar kind of nerve compression without all the downsides and the damage that's done by the traditional techniques.